Welcome to Your Health Today with Charlie Rouse. In our program today, we'll talk about health issues that are important to you and your family and how products from the world of natural medicine can help us all stay strong, fit, and healthy. And now, here's your host of Your Health Today, Chris Hall.
Well, it's good to have you with us today on Your Health Today with Dr. Charlie Rouse. Another great program on tap for you today. We're so happy and so pleased that we have had such a great response to our program. Dr. Rouse is so knowledgeable, and he really helps us, and he has a heart for all of us, not only our souls, but also our bodies. Because, we want to live for the Lord as long as we can in this world. But one of these days, these old bodies are going to say, well, that's it, I'm done, and we can go home to be with the Lord, right, Dr. Rouse? But this old vessel that we're living in, our physical bodies, we want to keep it strong and healthy because for me personally, I want to live for the Lord just as long as I possibly can, and for my wife and for my grandkids. How about you?
Yes, sir. We like qualitative and quantitative.
Yeah.
We want it all put together.
Yeah, so let me quickly give some good information again now. If you want to get in contact with all of our podcast programs, we have a wonderful website, yourhealthtodaypodcast.com. That's yourhealthtodaypodcast.com. Be sure to put the podcast in there, and you can go to the website, and you'll find a beautiful picture of Dr. Rouse, and you'll find all of our programs listed there. And at that website, you'll find links and different kinds of pages and a lot of information. And you'll find contact information as well for Dr. Rouse at yourhealthtodaypodcast.com. Also, of course, Dr. Rouse has the medicineman.com, themedicineman.com, and you can find all kinds of good products and information there. A new website is under construction for Dr. Rouse. If you want to contact him, you can contact him at drrouse@att.net. Just spell all of that out, drrouse@att.net, or you can give him a call at 229-436-0100, and Dr. Rouse will be happy to communicate with you, and he loves talking with people. Dr. Rouse, he's one of those guys that he never meets a stranger. He loves everybody. He'll sit down, patiently listen to you, and talk with you about how you can stay strong and healthy. And Dr. Rouse, it's amazing. We're all unique, and we all have our different kinds of problems and issues, and there's no one fix-all for everyone. So you really listen to people and say, okay, this will be good for you, or that will be good for you, right?
That's a very powerful statement there, because when you go to your doctor, the more information you take to he or she, right, the easier it is for them to read your body like a book. And yeah, when I'm listening, I'm really trying to listen, because, you might say, well, that old toe down there, that big toe down there, it just first is, well, right there, it tells you something. Right. That toe is connected to something else. Right. So every part of your body speaks loudly. So let us, hey, by the way, if you look down on the shin of your leg, and if it's kind of a dark yellowish color down there, that's usually an indicator that you better go have your blood sugars checked out. You say, what? Yeah, so hey, you never know, So read your body.
Boy, diabetes is such a thing with people now. And, if you're a borderline diabetic, borderline. Doctor says, okay, if you control yourself a little bit with your diet, you may not have to go on any kind of medicine. Is there something that can help borderline diabetics to stay out of that stuff that the doctors want to give if you got to cross the line, I guess you could say?
Yeah, there really, really, truly is. That's a great question, because and borderline means they look at your blood, A1C, got to be 7.0 or lower, and that's borderline. If you're 7, you're at that border. Yeah. And then blood sugars, under 100. But the question was, is there any nutrition that can get me back in and keep me down normal? And they call that vitamin Sylvester.
Okay.
Here in Georgia.
Yeah, we have a Sylvester, Georgia.
We have a Sylvester, Georgia.
Yes, we do.
Well, we have a plant in natural medicine called Sylvester. Yeah. And that's not the putty cat. Yeah. But when you swallow that herb, Sylvester, guess what? Your insulin is going to become sensitive and not resistant. And guess what? Your borderline will go away.
Now, that doesn't mean you can just go out and eat a whole cake and, drink Coca-Colas and that kind of thing. You still need to watch yourself, right?
Oh, my brother tells me that, now that he's taken Sylvester, he can cheat.
I
said, you're going to make me look bad, Rodney. You're right. You cannot do that. And even if the doctor gives you a prescription drug like metformin, that doesn't mean that you can now cheat. You still got to be sensible about it. So.
People just really need to just kind of be aware of how we can stay healthy and that thing. Before we get into what we want to talk about today, I did have someone ask me a question. They said, every time I hear Dr. Rouse talk about a product, I say to myself, I want it, and he said, if I got everything that Dr. Charlie talked about, I'd have 9,000 pieces of medicine to take every day. But that's not really necessary, right? Because you can talk with the people and you can say, well, this will be good for you, that will be good for you. No need to go buy a bucket full of what you sell. You can plan a program for each and every individual, right?
That is absolutely right. And don't just go buy a nutrition, because there's probably 10 that can be eliminated for one. Right. So even if you're already taking a handful, let a professional look at it, because they could probably reverse it. My mama, she lived to be almost 90, and she would watch me on Channel 10 at WALB TV regularly. Right. I did a regular show. She said, Charlie, or she called me Charles. She said, Charles, if I took everything you talk about on that show, and I said, Mom, here you are healthy at age 90. I said, you don't need to take diddly squat. Whatever you're doing and eating, I need to follow your protocol.
There you go, 90 and strong and healthy. All right. Well, we're going to talk about cruciferous plants today. Plants from the cross, So let's talk about a little bit about that, black seed oil and how it can be good for us.
That's a great portion of natural medicine, cruciferous, because every one of those plants, when they come up out of the ground, they come up in the shape of a cross.
Yeah, that's why it's called cruciferous.
It is,
right,
and
from the cross.
And farmers would recognize it. Ooh, if God put it in the cross before it became the plant, before it became to fruition, got to be good. And we're talking about the brassica, the cruciferous. We're talking about cauliflower, Brussels sprouts, broccoli, cabbage, and here we're talking about a seed.
Yeah.
Genesis 1 verse 29, God says the seed of the herb. And in Israel, they're the world's great producers of BLACK, black seed, and that black seed is of the mustard family. And when Jesus said, if you have faith as small as a mustard seed, then you can say to this mountain over here, move from here to there, and voila, it moves. And in other words, Jesus was using those words itself to describe the power of belief and the wonders that faith has. But that little mustard seed actually grows into a very prolific, gigantic, humongous element. And from that seed, from the black seed of Israel, and it's in the Bible under the name, like in the King James Version Bible, the Bible will call it CUMIN, the cumin seed, which in Hebrew must mean black seed,
something,
or mustard or something like that. And because it is of that, but in Israel, where medical science is looking for a cure for cancer, for the last 10 years, Israeli medical science, which is leading the world in cancer research, has found that this little black seed stops tumors, shrinks tumors. Stops, S-T-O-P. So if somebody had cancer and they're into chemotherapy or radiation or post-surgery, then the doctors of Israel are actually using in the therapy, in all cases, putting the patient on black seed, trying to get them into it, because it shrunk the tumor. But in the research, it found out that it protected the DNA from damage. Because, when you start radiating or chemotherapy, what you don't want to do is kill the patient by hurting their DNA. And black seed in the cancer patient was stopping inflammation. So that was good.
Right.
So now we had people that had, internal issues. They're radiating them. Well, that creates a massive amount of inflammation. But when they gave them black seed, these patients tolerated the chemo and the cancer therapy in a whole lot better way. Then they pulled it over here and they said, well, here we got a world full of coronavirus. I wonder what the black seed cruciferous would do to fight that off. And not only did it put the quietus on the virus, coronavirus, it also prevented bad bacteria like staphylococcal and streptococcal and E. coli, so like in urinary tract or prostatitis.
Right.
These people started finding, I got me something good here. And then all of our cancer patients who had had surgery to take out the tumor, radiation to shrink the tumor, chemotherapy to kill the tumor, we found that their wound healing, their surgery was just phenomenally getting better.
Yeah.
So then we said, if it's good for the cancer patient, can we all take it?
Yeah.
And you look down that list down there and you can say, well, whoa, Dr. Charlie has a list of stuff here that, good for the heart, good for the lungs, good for the kidneys, and it's great for sinus infections.
Yeah.
You ought to stand up here one day in a 12-hour business day at the Medicine Man. You'd be highly surprised at how many people come in asking for black seed, and it's all by word of mouth.
How about that? So black seed oil. Now, is that going to be like on the label? Do you come in and say, Dr. Rouse, I want some of that black seed oil? Is that on the label? Okay.
Yeah,
very good.
and it comes in a little bottle with pure oil. I can't drink it. I mean, it's nasty smelling.
Really?
So it's got. I've never tasted it, but when something smells bad, I ain't for it.
Right.
But see, I got a lab that can take the worst tasting oils and in soft gel it, put it inside a capsule, and you never taste it.
How about that?
So you swallow it down the goozle,
right,
and we'll get it into your system, and the next thing you know, you'll get the highest quality black seed oil available. And to my knowledge, it's way under $20.
Wow.
I mean, it's a
now, is that for a month? A month supply?
A month supply. So, that would have to be the bargain of the year right there.
It would be. So black seed oil, and if you want more information about black seed oil, you can call Dr. Rouse, 229-436-0100, or email him at drrouse@att.net. Dr. Rouse, I was in the store the other day, and somebody recognized me and said, I love listening to you and Dr. Rouse. And he wanted, I'm the communicator, I guess. These people ask me questions to ask you. He said, I have just a lot of problems with acid reflux. And he said he's gone to the doctor and they're suggesting this surgery, this thing or that thing going on. He said, I just don't want to go through all of that unless I absolutely have to. So what is there out of the natural world that can help with acid reflux? A lot of people, they have this kind of problem and they deal with it, and it's not a comfortable thing. So is there something you have on your shelf that can help somebody with that?
Yeah, and themedicineman.com, the product that'll show up on our website is called Heartburn Support. We try to make all these nutrition sound real easy. Heartburn Support has a plant called licorice, and it just heals. And in some cases, if it's a double trouble, like they've got a lot of GERD, a lot of reflux, we may have to bring in the oil from an orange peel. So sometimes we always start with Heartburn Support. Hopefully we go to orange peel extract. And then, natural can fix most everything. If not, doctors have some new, unique ways these days of nipping it in the bud. They can go in there and a good surgeon can fix heartburn. Did you know that? So it just depends on what your doctor says. But first of all, I'd go with heartburn support and orange peel extract, see how much my body responds.
Yeah, and it's a problem a lot of people have, and thank God for natural products as well as the advance in medicine in dealing with this as well. All right, we're going to take a break here on Your Health Today with Dr. Charlie Rouse. We'll be back in just a moment with more good information.
Your Health Today with Dr. Charlie Rouse. We'll be right back.
Who is Dr. Charlie Rouse? Dr. Rouse is a pharmacist with a degree from the University of Georgia College of Pharmacy. He is an expert in the world of natural medicine. He is the founder and owner of the Medicine Man's Corner, a business which specializes in pharmaceutical-grade nutritional vitamins, natural products, and more. Dr. Rouse is a natural product formulator, writer, author, lecturer, and radio and TV personality. Dr. Rouse is a husband and father. He is also a Christian who really cares about helping people. For more information on the many products Dr. Rouse has to offer, visit his website, themedicineman.com. You can contact Dr. Rouse through his website, or you can email him at drrouse@att.net. That's DOCTORROUSE@att.net. Or you can call Dr. Rouse at 229-436-0100 to set up a confidential professional healthcare consultation in person, over the phone, or on the internet. Dr. Rouse would love to hear from you.
Here's Chris Hall, host of Your Health Today with the Medicine Man, Dr. Charlie Rouse.
Dr. Rouse, what's good for bone health?
For women, the biggest threat to bone health is osteoporosis. That's a condition in which the bones lose their supporting tissue as well as their mineral content. Osteoporosis affects better than 20 million women in the United States, and a woman can reduce the risk of osteoporosis by engaging in regular exercise, not smoking, drinking less soda pops, and getting with supplementation. Certainly we know about calcium and vitamin D, but the most important nutrition for the bone is iproflavone, ipriflavone. Iproflavone. It's a natural for bone density.
His website is themedicineman.com.
Welcome back to Your Health Today with Dr. Charlie Rouse.
And we are back with Your Health Today with Dr. Charlie Rouse. Chris Hall, your host, and a good program today. We're talking about a lot of good and important information for you and for your family. Now, Dr. Rouse, we all need a good night's sleep. But, you know, the older you get, sometimes getting a good night's sleep is really a challenge, especially if you have something like an overactive bladder, BPH issues, enlarged prostate, things like that. To have a good sustained night of rest is very important, especially, I think, as you get older. And 7 or 8 hours we just need for our overall health. But what about people who get up constantly, maybe every hour and a half, every 2 hours, and have to go to the restroom, and it interrupts their good night's rest? Is there something in the world of natural medicine that can help us, me included, with this?
It is by far one of the most common medical problems. And you know, it's men and women, because you mentioned prostate over there, that's in the man. And sometimes people ask Dr. Charlie, they say, is my bladder capacity shrinking? Can I not hold as much fluid as I used to?
Yeah.
Does it not stretch out like it could? And when somebody is dealing with an overactive bladder, that makes them go to the bathroom several times, too frequently, more often than not. They can even drive from here to Atlanta without a lot of rest stop visits, and to get into the bed and have to continually deal with urination, that could be rather difficult. But remember this, the name of the vitamin, the name of the herbal nutrition you're looking for is Angelica. Boy, that's a good name.
Sounds good.
Yeah.
We need an angel every now and then.
Yeah, but I remember when the Lord fed the Israelites in the wilderness, he gave them angel food, manna, and obviously he grew this, and it grows in the extreme weather conditions of Iceland.
Really?
And when people looked at that, they said, look at that plant. We're talking about everything else is frozen asunder, and that little plant, Angelica, is blossoming like a rose in Georgia.
Really?
And so they said, well, if it's got that much hardiness to it, they took it to the lab and they started tinkering with it and experimenting.
You
with
mad
it.
scientist, I declare. You see something and say, let's make something out of this.
We take the fruit, we take the leaf, we take the root, we take the plant, we use it. And folk medicine has a lot to be said, doesn't it? Because look what we've learned from the native Indians.
Right.
Well, in Iceland, I've never been there, but obviously folk medicine must have been around. And yes, sir, Angelica. Now, the name of the product, if you went to themedicineman.com, is simply called Bladder Manager.
Bladder Manager.
Bladder Manager.
Okay, bladder. That's easy to remember.
And the neat thing about
Manager.
it is you only have, most people can only need one pill a day. Okay. Now, if somebody's got a lot of frequency and urgency, urinary difficulty, we could let them take one tablet twice a day, or maybe even 3 times a day. And the truth is that once they start taking it after a day or 2 or 3, they will notice that something is really getting healthier, better. And it makes the sphincter muscle. It's a little smooth muscle that controls the ability of the bladder to retain as much fluid as possible, and then open up when it needs to. And even if you know somebody, Chris, that has bedwetting problems like children, Angelica is the number 1 nutrition for that. And people that constantly need to go to the bathroom, and or men or women that are fighting incontinence, this is the herb. It's called Bladder Manager.
Okay. Now, is it a replacement for, or will it work with like Flomax, Stamulocin, things like that? Is this a complementary thing to it? Or?
It can definitely complement Flomax, and in many cases, and in most cases, doctors, physicians are able to substitute and use natural medicine, and Bladder Manager is a good alternative to having to take a prescription drug, because sometimes our gentlemen, when they're on Flomax, a good portion of them have side effects that makes them feel spacey, and you can't go around all day long feeling like you're on a spacey trip, and you take them off the medicine, they get better, but then they say, well, now I got a bladder problem, so we're in a Twix.
All right. Yeah. Well, it's good information from Dr. Rouse on this very important issue. Dr. Rouse, again, I had a question that was kind of communicated to me about gout. My dad suffered with gout. And he, bless his heart, I guess genetically, he kind of passed it down to me. Now, let me tell you what I do for it, and let's see if I'm doing good. I take cherry seed extract on a regular basis, and I watch high protein foods. Not that I don't eat any, but I don't live on them. I'm very careful with them, and that seems to control my outbreaks of gout. I haven't had one. I very infrequently do I have an outbreak with gout. So am I doing good? Am I doing right?
You told me 2 things today while we were on the radio show that have already given me high clues that you're going to be gout preventative. One, you said you drink water, 2 cups of coffee in the morning, and water throughout the day. Well, obviously, hydration and water keep the uric acid crystals from forming, and kaboom, you're good to go. And the cherry is definitely the number 1 nutrition. Then they came along and found that celery was a super nutrition. And then down here in South America, the Spanish language, they call it Chandra Pidra. That means stone breaker.
Oh, really?
Stonebreaker.
Yeah, I like that.
Chandra Pidra. Yeah. But anyhow, we now have a new formula called uric acid support. It's under the medicineman.com.
Cool. Uric acid support.
And it has all the cherries, all the celeries, and all the stone breakers.
And that's where the gout comes in, right? A buildup of uric acid in your body. Which is, what is it, a form of arthritis?
Arthritis.
Is that what I understand?
Exactly. And unfortunately, the stone itself, or the crystal, is heavy, so it floats down into the blood. It gets way down there in the toe and gets caught in the big toe way down there on the far end.
It's a lot of fun if you've never had the gout. It's a lot of All right, well, let's talk a little bit about gastrointestinal health. We want to be able to eat stuff, enjoy stuff, and not, pay a price for eating that thing you like to eat, or drinking that thing you like to drink. So how can we keep our gut good, and so we can really enjoy what God has provided in this wonderful world for us?
You better keep that gut good, because I remember one time on our radio show, before we started doing this modern day podcasting, Chris said that his gallbladder went to fussing one time.
Yes, it did.
And he said, man, when you got a fussy gut and a bad gallbladder, that thing don't stay.
And it's gone now.
that was a blessing.
It was.
Whatever you do, go fish it out.
Man, I'm telling you.
Were they able to do it laparoscopically?
No.
Where they punch a hole? They actually cut you wide open?
Well, they did it laparoscopy, but I had to stay in the hospital because I had some infection built up.
So you were bad good. You were bad good at it.
Yeah.
So let me talk to all of our folks to prevent all of you gut syndrome, so you don't have to have a gallbladder removed like Brother Chris did. Yeah. And we call it Robert's formula. Robert is an old sailor, 200-year-old formula that's been passed down from century to century. And Robert's formula has been through more medical clinical tests. They use the stalk of a pineapple. They use the leaf of a cabbage. They use a root from a marshmallow, and it's all kind of good stuff. And echinacea, because you just mentioned
echinacea.
Just mentioned when that gallbladder goes out, it usually leaves infection behind.
Right.
And so they found that if you have any problem with irritable bowel syndrome, or any problem with gallbladder, or any problem down there that's gassy, or just discomforting, you just don't feel good, Robert's formula, it's the best thing that I know. And it'll stop diarrhea, it'll stop constipation, it helps the motility of the intestines to get back to normal.
Does it work pretty quickly when you take it?
Quickly. So the belching and the bloating, oh man, I didn't know I could finally feel relief.
Yeah.
And people who have irritable bowel syndrome or colon problems, they love Robert's formula. We get calls, Chris, from all over the world. Over the world for that one product, Robert's formula.
How about that? Well, that sounds good. And if you want more information about Robert's formula or anything we've talked about today, or maybe an issue you're dealing with and you want to talk to Dr. Rouse about it, again, you can call him. And it's 229, that's our area code where we broadcast from, 229-436-0100. Or you can send Dr. Rouse an email at drrouse@att.net. That's all one word there. Spell out Dr. Rouse at att.net. And don't forget now about our website, yourhealthtodaypodcast.com. Be sure to put the podcast in there, yourhealthtodaypodcast.com. You'll find all of our programs there, links, pages, and information that is very important for you to be able to use to get in contact with Dr. Rouse. And you can check out his website, themedicineman.com. That's themedicineman.com. And a new website is coming down the way, and when we have that information, we'll be happy to pass it along to you. But Dr. Rouse, good program today. Thank you for being with us, and stay healthy.
It's always a joy. Your Health Today podcast.
Yeah, absolutely.
All
right. Well, we'll be back again very, very soon. Thank you for joining us today, and may God bless you.
Thank you for joining us for our program today. You can reach Dr. Rouse online through his website, themedicineman.com, or you can email Dr. Rouse at drrouse@att.net. Dr. Rouse is also available by phone at 229-436-0100. Join us again next time for Your Health Today with Dr. Charlie Rouse. Until then, please stay safe and may God bless you.